Thanks, everybody. I was glad to be here and not home gardening, which was what it was looking like Friday evening. And I want to thank the organizers for putting this topic again on your agenda. We spoke about this last year. When we talked about it last year, it was still something in the works. And I'm proud to tell you that I think that you're the first outside group to actually hear about the National Vaccine Plan now that it's been out. We released it at the National Vaccine Advisory Committee meeting in February and had a chance to begin to talk about it. So that's what the goal of this talk is. Many of the discussions you've already heard this morning are largely about the vaccine component of other parts of federal programs, and you've got a great opportunity to get, honestly, up-to-the-minute updates. Most impressed with Marianne's talk where you had sort of heard about the pathway the FDA is going to take on the NVAC vaccine from an advisory committee meeting that summarized this last Thursday. So your timing is good. So again, I think about this as the roadmap for the next decade. We've had this in the works for some time. I'm going to talk a little bit of the history of the development of this, but we see this as a 10-year vision. We've asked our National Vaccine Advisory Committee to keep after us and take a look at this and the opportunity for some mid-course corrections along the way. But knowing how much can change in a decade, it really can't be much more forward-thinking than that. But at the same time, I always ask myself the question of, well, where are we going to be in 50 years? And that sometimes makes the discussion a lot easier to think about, because then it lets people dream in a way that they can't if they try to think about what they're going to be doing next year, or 2 years, or 3 years, or 5 years. So while this is a 10-year vision, it's really trying to think about what that initial path is going to be to a longer vision. And maybe we can talk some more about that during the discussion. So the vaccine and immunization framework is really the soup to nuts of immunizations. That starts really with the surveillance to understand what the risks are or what the threats are for which a vaccine might have an opportunity to do something about it and mitigate its impact, all the way through to the testing and licensure, use of the vaccine, and then measuring what the impact is going to be. And we've had some discussions about vaccine safety, so people are concerned about the impact overall, and I think we're obligated to make sure we take a careful look at that. And it's measuring that impact and making the case for that impact that I think that allows us to continue to make progress, particularly in making the pitch for additional resources, because if you can make the case for what you've accomplished, you have a better chance of getting some more. The National Vaccine Program Office was created by Congress, so those forward-looking congressmen in the late 80s were thinking about the need for a coordinated program. And again, this is the soup to nuts in a different way, that the legislation talked about the range of things that the National Vaccine Program is. And so just to be clear, the National Vaccine Program constitutes everything about vaccines in the United States. The National Vaccine Program Office is me and my little office who's trying to keep track of all this stuff, and we can talk some more about that. The director of the National Vaccine Program is technically the Assistant Secretary for Health, whom has that responsibility, and we work for him. So again, it's these components of research and development, testing, licensure, but also into the use of the vaccines, from how they're produced to how they're procured to how they're distributed, evaluating them, and then getting into this overall coordination, which is more of what my office does and what the National Vaccine Plan is really intended to signify. When we were working on developing this plan, I think I may have showed this last year, we had Rand help us to try to think strategically about how we're going to do this. And Rand loved to do these wiring diagrams of really talking about the system. And what I find, I don't know if you can see this very well, but you'll all get copies of this, but what I found most helpful in this wiring diagram from, again, similar things I've talked about, from the research all the way through use and measuring the impact, was that people would then look for their box and say, where am I in this wiring diagram? And I think it served more as a Rorschach test for everybody in the system to say, well, I really need to be here. I need to be with a dotted line to that guy. Well, again, none of these are perfect, but they're a construct, and I think they've helped our discussions. And as we've developed the National Vaccine Plan, I think this kind of thing has been very useful to bring people in to recognize that this is a national and not a federal plan. Obviously, the feds have a big piece of this, but the point is that there's a lot more that has to happen to achieve all the goals that I'll talk about than just the federal government can accomplish. So the way I often say that is you have to figure out where you are in the group picture, and once you're in the picture, you can't be cut out so easily. So in the legislation that brought the National Vaccine Program Office into being in the late 80s, there was the requirement for the development of a plan, and that plan to update annually. When I took my job in 2002, I was faced with this real history that the only national vaccine plan that had been written was published in 1994, so it was probably written a little bit before that, and there hadn't been one since. So just to remember, again, how much things change. In 1994, Nelson Mandela was elected president. The Dow was 38.34. Gas cost $1.09. And for those of you who follow other pieces of news, that was when OJ was driving his white Bronco around LA. So now we flash forward, and this is the cover of the National Vaccine Plan. I didn't bring the prop with me, but now you can find this as a PDF on the internet. And as I've talked about, this is really a national and not a federal plan, and I'll get into that some more. So the overall structure of this is that, again, I see this as a 10-year vision that is, I think, quite comprehensive. When we developed the first draft of this and put it out for public comment in 2008, we had lots of comments, and I think that I challenge everybody, and I continue to challenge you, that if there's something that's part of the immunization and vaccine system that's not in the plan, we need to know about it because it needs to be there. So take a look at it for that, and we'll give you bonus credits if you can find something, but I think it actually does incorporate the full system. You'll see that there are a range of things that we've talked about, from our research and development, safety, communications, as Mr. Greenwood talked about this morning, the importance of getting that message right and making the case for the value of vaccines, and a number of other things, including global partnerships. So that's what this is about. The asterisk is important, and probably this is something that's relevant to many of you, because vaccines often mean other things beyond vaccines against infectious diseases. For our purposes and the way the legislation was written, while we recognize that, and there is a whole emerging area of therapeutic vaccines, the focus here is on vaccines for infectious diseases and their prevention. So the structure of this plan is 5 broad goals. And there are many strategies and objectives that I'll get into just briefly, but I just want to introduce you to it and hope that you'll take a closer look at it. Developing new and improved vaccines, enhancing the vaccine safety system, aspects about education and communication, because we recognize that people from parents to policymakers need to make informed decisions about vaccines. Goal 4 is about the supply of vaccines and their use. And a large part of this is not only to make sure that they have the impact that they're intended to, but that they have that impact as equitably as possible, particularly in the United States. And for this plan, recognizing the global nature of not only infectious diseases, but of the vaccine industry, we've added a global goal as well. And that goal, the global goal, was not part of the earlier plan. You'll see this in a way that's presented in the plan, but just to give you a sense of the number of players involved here. On the left-hand column are we should probably have a quiz on Fed speak and what the acronyms are. I think most of these are the kinds of acronyms that you might actually have heard about. But these are different parts of the components of the federal government, and recognizing as you go down the list that a large number of these are the Department of Health and Human Services, but it also includes the Department of Defense, the Department of Justice, the Department of State, USAID, and the VA. Again, recognizing that among the federal stakeholders, there's more to this than HHS. We often think about FDA, NIH, CDC, maybe HRSA, who has the Injury Compensation Program, but there are a large number of players that have elements of this plan. But I think more importantly is the recognition of the number of non-federal stakeholders and the sectors that have to be represented. Obviously, you're one of these sectors, but the healthcare providers, the healthcare system itself, and as Mr. Greenwood was talking about, the preventive value of vaccines in dollars and cents is one of the things I think will have an increasing role as we look at trying to look at budget issues down the road. The role of insurance, governments, not just federal, but state, local, and tribal, academia, advocacy organizations, philanthropic organizations, manufacturers, which is largely represented here, and then some of the global players that are all part of the overall number of stakeholders. So when you look at this, when you look at the plan, when you get a chance to look at it, it's not very large, and this is a strategic vision, and I'll talk a little bit about the implementation plan that's in the works, because I think that's where the rubber is really going to meet the road. But again, all those same agencies and departments as part of the federal government are here, and then for each of the goals, there are a number of objectives and strategies. What we just tried to depict here is who's going to be in these other group pictures. So again, this is the agencies across the top, and there's a similar page for those the non-federal sectors. Again, I think it's important to recognize the broad number of players that have to come in together here, and importantly, that they have to be part of the overall program. So when you get to the document, the last 2 pages are this large spreadsheet, which really represents this is the whole shooting match. That are all the components of the system that have to do all these things to achieve these broad goals.